Welcome. Have you ever felt like the world is constantly swaying, even when you're standing still? Or perhaps struggled to read street signs while walking? You might be experiencing symptoms of a condition called bilateral vestibulopathy. In this video, we'll explore what this disorder is, how it affects your balance, and what can be done about it. Bilateral vestibulopathy, or BV, occurs when both of your inner ear's vestibular systems are damaged. These systems are crucial for maintaining balance and spatial orientation. There isn't always a single clear cause, but several factors are known to contribute. The most common cause is exposure to ototoxic medications, particularly certain antibiotics like gentamicin. Other potential causes include autoimmune diseases, meningitis, head trauma, Meniere's disease, and in some cases, the cause remains unknown. This is termed idiopathic BV. To understand BV, we need to delve into the inner ear. The vestibular system contains structures called semicircular canals and otolith organs. These structures detect head movements and gravity, sending signals to the brain. In BV, these structures are damaged, disrupting the normal flow of information. This mismatch between what the eye's muscles and vestibular system are sensing leads to the sensation of dizziness, unsteadiness, and difficulty with gaze stabilization. The brain struggles to compensate for the missing vestibular input, resulting in balance deficit. While precise epidemiological data on bilateral vestibulopathy is limited, it's considered a relatively rare condition. However, it's likely underdiagnosed, as symptoms can be subtle or attributed to other causes. BV affects individuals of all ages, but it's more commonly diagnosed in older adults, potentially due to age, related changes in the vestibular system, or increased exposure to ototoxic medications over time. Studies suggest that idiopathic BV, where the cause is unknown, is becoming more prevalent. The symptoms of bilateral vestibulopathy can significantly impact daily life. The hallmark symptom is imbalance and unsteadiness, particularly when walking in the dark or on uneven surfaces. Another common symptom is oscillopsia, a blurring or bouncing of vision with head movement. This makes it difficult to read signs or recognize faces while walking or riding in a car. Many individuals also experience fatigue due to the constant effort required to maintain balance. Some patients might also experience cognitive difficulties, such as impaired spatial awareness and difficulty multitasking. Diagnosing BV involves a comprehensive evaluation by a healthcare professional, usually an audiologist or neurotologist. This typically includes a detailed medical history and a physical examination. Specific tests are performed to assess vestibular function, such as the video head impulse test, or VHA, which measures the vestibulo-ocular reflex, or VOR. Caloric testing, which stimulates the inner ear with warm and cold air or water, is also often used. Other tests like posturography may be used to assess balance control. Imaging studies, such as MRI, might be performed to rule out other underlying neurological conditions. While bilateral vestibulopathy doesn't have distinct types, in the same way some diseases do, the severity of symptoms can vary significantly. Some individuals may experience mild imbalance and only occasional oscillopsia, while others are severely debilitated. The classification is therefore primarily based on the degree of functional impairment and the impact on daily activities. Unfortunately, there's currently no cure for bilateral vestibulopathy. However, various strategies can help manage symptoms and improve quality of life. Vestibular rehabilitation therapy, or VRT, is the cornerstone of treatment. VRT involves exercises designed to retrain the brain to compensate for the loss of vestibular function. Balance exercises, gaze stabilization exercises, and habituation exercises are commonly used. Assistive devices, such as canes or walkers, may be helpful for some individuals. In rare cases, surgical interventions might be considered, but these are not commonly performed. Addressing any underlying medical conditions, like autoimmune disorders, is also important. Preventing bilateral vestibulopathy primarily involves avoiding known risk factors. This includes using ototoxic medications cautiously and only when absolutely necessary. If ototoxic medications are required, regular monitoring of hearing and vestibular function is crucial. Protecting the head from injury through the use of helmets during activities with a risk of head trauma can also help. Early detection and treatment of inner ear infections may reduce the risk of long-term vestibular damage. The prognosis for bilateral vestibulopathy varies depending on the underlying cause, the severity of symptoms, and the individual's response to treatment. While complete recovery is uncommon, many individuals can significantly improve their balance and reduce their symptoms with vestibular rehabilitation therapy and appropriate management strategies. Research continues to explore new treatments and strategies for improving outcomes. One promising area of research involves the development of vestibular implants, which could potentially restore vestibular function directly. Additionally, studies are investigating the use of new medications and therapies to promote vestibular regeneration and neuroplasticity.